Welcome to Preceptor Module 1, Roles and Relationships, brought to you by the Montana Center to Advance Health Through Nursing, Academic Progression in Nursing, APIN grant, funded by the Robert Wood Johnson Foundation. The Montana Con is the official state coalition for the Future of Nursing Campaign for Action in Montana, co-led by Casey Blumenthal, Vice President of MHA, or Montana Hospital Association, and Cynthia Gustafson, Executive Director of the Montana Board of Nursing. In a few minutes, I'm going to go to a series of websites and provide some links that we can look at together. And one is the Montana Con website, where you can see the resource sidebar. There will be a series of web links, transcripts of this module and the other modules, references, other information that we have that we want to give you for each module. So you can access these modules on the Montana Con website and all the resources. My name is Sandra Kuntz, and I'm a member of the faculty at Montana State University and the co-project director of the APIN grant. I am pleased to welcome you to this first webinar for Preceptors. The purpose of the 5 modules in this series is to enhance preceptor effectiveness and satisfaction with the precepting experience. Studies by Henderson et al. 2006, Parsons 2007, Burns and Northcutt 2009, and Duteau 2012, and many others that have published since, suggest that educational offerings improve preceptor self-efficacy, confidence, effectiveness, and satisfaction with the role. Criteria for successful completion of this webinar include attending the entire webinar for Module 1, reading the assigned chapters in Ulrich 2012, the book that is assigned with these webinars, and affirming completion at the end of the webinar, and then completing and submitting the evaluation form at the end of the webinar. In addition to this module on roles and relationships, there are 4 more modules. Module 2 covers communication, Module 3, learning styles and teaching strategies, Module 4, planning a precepted learning experience, and Module 5 will cover evaluation and feedback. Although we are bringing you the latest evidence related to preceptor practice, we will no doubt only touch on some of the important issues related to your work as a preceptor. For this reason, we have created a password-protected blog, a discussion board, for modules 1 through 4. With this blog, you also receive contact hours per module. This space, if you decide to participate, and we hope you will, is provided for your reflection and application of the precepting experience. In sharing this information, we will all benefit. So we hope you will share your insights from your experience as a preceptor in the blog area. I just want to say that there is no conflict of interest associated with anyone who has prepared these modules. And the contact hours are provided by the Montana Nurses Association, an approved provider. The primary objective for Module 1 is to define roles and relationships critical to preceptor success. Your success and satisfaction as a preceptor impacts, first, you as the preceptor who has stepped up to guide a student, a new nurse, or a new employee towards success based on a set of specific objectives. Next, your satisfaction and success is directly related to the healthcare organization you represent. Access, as that organization has access to a next generation of employee, or retention and satisfaction of a new employee. Your success and satisfaction has a positive effect on the preceptee, as well as faculty and academic institutions you are working with. And finally, your work in this role will directly and indirectly impact patients, both the quality and safety of patient care. During this module, we will begin the process of answering the following inquiry questions. First, how do current national standards and initiatives impact and enhance the role of the preceptor? What competencies are essential for preceptor practice? What are the roles, responsibilities, and relationships necessary for a dynamic preceptor, preceptee, and faculty or organization partnership? Fourth, what is the role of the preceptor as coach? And last, what coaching strategies inspire growth and development of the preceptee? Just in the way of context, RNs are the largest sector of the healthcare workforce. So what do nurses do? The ANA has said in their definition of nursing that a nurse diagnoses and treats a human response to actual or potential health problems and involves individuals, families, communities, and populations. We have a tremendous impact on prevention, health promotion, health protection, alleviation of suffering, and advocacy. So there is a tremendous need. According to the ANA, the average age of employed RNs is 45.5 years, with 45% of RNs 50 years or older. And we're all growing older by the day, I might say. In July and August 2009, journal Health Affairs Beerhouse found that despite the current easing of the nursing shortage due to the recession and many older nurses staying in practice, the U.S. nursing shortage is projected to grow to 260,000 RNs by 2025. There is a critical need in all states across the country to attract and prepare and retain nurses once they are licensed and employed. Results of the National Council of State Boards of Nursing National Transition to Practice study by Preceptor et al. 2015 found that new RN graduates who had a primary preceptor during their first 3 months of employment practiced at higher competency levels with fewer errors and were less likely to leave the profession than unprecepted new grads. So we know for sure that precepting matters. I will speak briefly about the support for preceptors provided by the National Council for State Boards of Nursing. You might also want to determine if there are any rules related to precepting within your State Board of Nursing requirements. According to Ulrich, 2012, preceptors need to be grounded in the ANA Code of Ethics and the 16 Standards of Practice and Professional Performance. The scope and standards are the authoritative statements of duties that all RNs, regardless of role, population, or specialty, are expected to perform competently. These standards provide the basis and rationale for our role as teachers and preceptors. The reading in Ulrich provides a quick overview of not only the ANA Code of Ethics, but also 4 Institute of Medicine reports that identified areas where nurses contribute to the reduction of errors and improvement in quality and safety. From this work, the cues and competencies were established. The AAPN Essentials and the National League for Nursing Competencies for Nursing Education also impact our practice. And finally, I want to mention the Academy of Preceptor Advancement, which establishes some of the core knowledge we need to practice as preceptors. So just a few words about this model. This is a National Council of State Boards of Nursing model, Transition to Practice. And we're going to go to this website in a few minutes where you can see more about this. But this is the Transition to Practice initiative. There is a window, we know. We have the students in baccalaureate programs for 4 years. They engage in a lot of education, a number of courses and clinicals. They graduate, and then they have this period of transition to practice. So this model really does show the relationship between education and practice and regulation of nursing, and the role of education, the role of practice, and what a nursing regulation does. One of the quotes from the Transition to Practice website says health institutions with transition to practice programs have seen a marked drop in attrition along with improved patient outcomes. There is a need for best practices for training new nurses that can be replicated across the country to ensure consistent quality of care and drop the alarming turnover rates of new nurses. So they really feel that in one of the things they're looking at is the Future of Nursing IOM document and the implementation of nurse residency programs. And so they have established a very interesting, some modules related to this. And this is something that maybe you would want to look into in the future. They're based on the QSIN competencies, by the way. The second point, just about state boards of nursing rules, and I'll just mention this briefly. Most boards of nursing have established rules related to how and when preceptors can be utilized to enhance pre-licensure student education. For example, in Montana, we have the Board of Nursing Administrative Rule 24.159.665, and it says that for us in Montana, clinical preceptors may be used to enhance but not replace faculty-directed clinical learning experiences. And they also mentioned that preceptors can only be utilized for 20% of the student's total clinical hours, and that's a pre-licensure requirement. Now, our rules are changing, and so we'll have to be looking for those changing and be aware of them. In other states, if you go to your Board of Nursing website and Google the preceptor, the word preceptor, hopefully that will pop up. I just did this quickly for the Texas Board of Nursing, and I found several things related to students after a student has received clinical and didactic instruction in basic areas of nursing or instruction specific to a particular course. Clinical preceptors may be used in one-on-one relationships with staff nurses to enhance clinical learning. Preceptors serve as faculty extenders, and so there's a lot of language related to this, how many they can supervise, what the faculty are doing, and so your Board of Nursing rules are really important. And so these two questions are questions you want to answer for yourself, depending on what state you're from. So I've mentioned the IOM reports, and these reports have been available for a number of years and have really impacted our practice. All four of these really speaking of what nursing can do to improve quality and safety. And as a result of these reports, these initial reports, the quality and safety education for nurses was established, and that is at the QSIN. We call it the QSIN competencies. There are 6 areas that we really look at in detail, and we'll go to this website shortly. The areas are quality improvement, safety, teamwork and collaboration, patient-centered care, evidence-based practice, and informatics. And so if we can form an entire program, educational program around just those competencies, and we can really produce, often these competencies alone will help us develop these nurses into safe and competent practitioners. So the other and the last, probably the most dramatic change in my lifetime as a professional nurse, and I've been in practice since, well, for a long time, almost 40 years. The Future of Nursing, Leading Change, Advancing Health has done more for our profession than any other document that I have ever seen or been a part of. And there have been a lot of things in those 40 years that have come along, but nothing quite as impactful as this IOM report, The Future of Nursing. And we're probably all well aware of that now. The other, I'll just mention briefly the American Association of Colleges of Nursing, and that website, the NLN I've mentioned. Their website is down right at the moment. They're under construction, so I won't be able to take you there to that one. But the American Academy for Preceptor Advancement is the last one. We'll go to that just very shortly. The Scope and Standards of Practice for Preceptor Advancement. This is a 2014 document just out. This is one way that preceptors can be certified. And if that's your choice, you certainly don't need to be certified. But if you want to increase your practice and you're doing a lot of precepting, you should be crediting yourself for that work. And this is one way of doing it. It's a very nice program that has been established by this group, and I will show you their website in just a few minutes. So let me just take a moment, and what I'm going to do is go to the website so we can look at this together. First of all, I mentioned that this is the Montana Con website where the preceptor modules live. We'll have 3 is going to be loaded soon. 4 will be coming right after that, and then Module 5. And then there will be a place where the resources are located here. This is a part of the APIN grant, and this is Montana, but it is initiative. The Academic Progression in Nursing Initiative is across the country through the Robert Wood Johnson Foundation. And so these modules are available with the free contact hours during the duration of the APIN grant. The next area, I've mentioned the National Council for State Boards of Nursing. They're really doing some dynamic work, and as you can see, I have clicked on the Research tab, and under the Research tab, you see a simulation study. This is a national study on they finished some of this initial work. It's a longitudinal study. It's examining the value of simulation compared to clinical experience to determine if simulation can be substituted in place for actual clinical experience. And we were really surprised to see that nurses that had more simulation did as well as nurses that had that same amount of clinical time. And so in this era when it's very difficult to find clinical sites, understanding the value of simulation, not just to teach new concepts, but to actually use it in real time as if you're taking care of patients. And so this is a very dramatic study. The National RN Workforce Study is here, but the one I wanted to actually highlight was the Transition to Practice, which has to do more with precepting. At this website, you can see that there's a Transition to Practice toolkit, really valuable, has wonderful resources, and then the study results of Spector's work, and I just referred to it. But I recommend this area just for preceptors because there's a lot to know that we have in common nationally, no matter what state we're working in. Whether it's a rural state, in a rural area, a more urban area, the National Council for State Boards of Nursing is helping us with a lot of the work that they're doing. This is the QSIN, the Quality, Safety, Education, and Nursing website. It's housed on the Case Western Reserve University website, it looks like. And if you look under competencies for pre-licensed knowledge, skills, and attitudes, then you go down and click on the patient-centered. We can see what pre-licensure students ought to be able to do knowledge-wise, skill-wise, attitude-wise. There is a lot of information here, and it's very helpful to try to understand better what are students bringing with them that they're being taught in their program, and what do we need to continue with and make sure that they're doing in practice when they come to us as preceptors. This is another area where there is a lot of competencies located for baccalaureate education, the APIN essentials, the master's education, and doctoral education. And I just like to say that these modules are basic to every type of nursing education. So whether you are precepting a master's or a doctoral student, of course they have different objectives than an undergraduate. They are certainly nurses compared to undergraduates, but this is where you can find what should they be able to do and what level are they working at. Again, I can't take you to the NLN website, but here is the American Academy for Preceptor Advancement. You can look at, this is where you can see the certification handbook. You can look at the resources, where you can get different resources. These are all excellent books. The stories that are available for this, there are some wonderful stories, and I encourage you to write your preceptor story and bring it to them. I just enjoy the 3 located here, and I've read them, and they're just great. So you can't miss by going to that website. So let's go back to our slideshow. Okay. So good. We just took a moment. So one of the things we hope, I mentioned this, that we really do hope that you will blog about your experience. You might, for instance, in your blog, make a note of an instance where the code of ethics, which, a lot of nurses, you have it in school, but you pull that code of ethics or the standards of nursing practice up again, and you think, oh my goodness, this is where my practice is supported, why I'm doing every day what I'm doing. And you can help guide students based on explaining why you're taking that action. Sometimes we just know what we know, and we do what we do. And when someone says, why did you do that? Just remember, you can always pull out the code of ethics, because it's probably in there, or the standards of practice. So blog about that if you get a chance. So there are probably a number of reasons that you are serving as a preceptor. You might be serving because you want to be a role model, or perhaps you're giving back to the profession. That's certainly the reason I would precept, because I have been guided and cared for along the way in all these years, and I love to see people progress and do well and be happy in this profession. It's a great profession. You might just receive a reward by knowing you have helped a student or a nurse succeed. You may be thinking, I'm going to prevent a past sink or swim thrown to the lions experience. And that's something that Jose Irizarry on the website tells his story. That's exactly why he precepts. You may be interested in personal growth, increased knowledge, and you want to know how to do what you're doing better. Or you may very pragmatically be interested in the professional gain, clinical ladder advancement, role enhancement, additional compensation. And I'm hoping more and more that this is something we didn't see in the past at all. Preceptors, and often we're still in this situation where preceptors work out of the goodness of their heart, but more and more institutions are really seeing the value of this important role, and they are rewarding in one way or another that role and anyone who will participate. So there are a number of definitions. One from Ulrich on page 1 is precepting is an organized, evidence-based, outcome-driven approach to assure competent practice. Preceptor is an individual with demonstrated competence in a specific area who serves as a teacher, coach, leader, influencer, facilitator, evaluator, socialization agent, on and on. They validate competencies for another individual. And this is all on page 1 of Ulrich. Parsons says that an experienced nurse is a preceptor. A preceptor is an experienced nurse who develops a one-to-one, time-limited, often voluntary relationship. This was in 2007, and often that was the case, with a nursing student, providing guidance and supervision to promote clinical competence and skill development. So there's quite a history of precepting. As far as people can see, and this has been reported by several authors, Young in 2007, Burns in 2009, both talk about the history. We think that it started in hospitals and other clinical agencies in the mid-1970s, possibly as a result of Marlene Kramer 1974's work. She wrote about reality shock for beginning practitioners. And Patricia Benner's novice to expert work also may have influenced the early beginning of preceptors. So I've mentioned the value, but I want to say again that the value of preceptors to the students is that you often are those the people who are the bridge between theory and practice, that gap between theory and practice. They're really important, and that's why the partnerships are so important between education and practice. To students, just the achievement of planned learning outcomes, that's a huge contribution. They go and they can actually implement what they're learning. Their improvement in skill, reduction in anxiety often, their increased rate of role socialization. This is another very important part. So for academia, what the preceptor brings to academia is that preceptors enrich the overall educational experience, and we know that. We can do so much from the academic setting, and then we really need the practice piece. Preceptors also provide that capstone, which is so important for integration of all of the ideas in the beginning, launching of that nurse. To the organization, preceptor adds that ability for the organization to preview potential new employees. I'm going to, I want you to hear Tim Orcutt talk about what his hospital, North Valley Hospital, and how they use preceptors and why.
Hello, my name is Tim Orcutt, and I am the Education and Training Specialist at North Valley Hospital in Whitefish, Montana. I wanted to briefly explain the benefits of our preceptorship program. We have implemented a preceptorship program which recognizes nurses with superior clinical skills, trains them, and also rewards them for their time. We have recognized the importance and the contributions a well-prepared preceptor can have at our organization. They provide new employees with a first impression. We want first impressions that result in long-term relationships, not just a single date. We also recognize the difficult world nurses face every day. We ask them to do more and more with less time. This also holds true to orientation programs. A well-trained and prepared preceptor can ensure the best training in these environments. They do this by assessing competency and developing goals and objectives. They learn to do that in preceptor programs. Our preceptors are providing leadership, mentorship, counseling, clinical expertise, socialization, and education. These are not attributes or skills easily possessed, and they take development and teaching, and these are done in the preceptor program as well. Our program has resulted in improved onboarding of new employees, improved turnover, lessened orientation times, and most importantly, improved competency. Nursing students, recent graduates, and other nurses have recognized North Valley as a leader in healthcare and a place where many of them will look to start their career. We contribute this to our preceptorship program.
There are a number of studies, more and more literature. It's primarily qualitative work, qualitative studies, that reinforce this extensive description of the role that includes all of these areas: teacher and coach, leader, influencer, facilitator, socialization specialist, role model, and protector, evaluator, and feedback provider. So those areas and the literature is just rich with lots of information about how these roles are implemented. I really like this model. I want to say that this model is from Elsevier, the Mosby's Preceptor course, and it's quite extensive. There are a lot of modules. You can take some and not others, and this material is available through 2 organizations. You can sign up and be a part of Mosby's Preceptor modules. But I thought that this model that they use to show the role of the preceptor really simplifies that whole idea that the protector, the educator, the facilitator are critically important, and you're doing something under each of those roles throughout whatever you're doing with a person who's a preceptor. This first role, Ulrich talks about, and Orling and Hallberg, this is all documented in your reading. This is in your reading on page 8, that the teacher and coach really creates a space for learning, provides concrete illustrations, provides control over the opportunities and pace of learning, and allows time for reflection. And as an example of this, there is a website that will be linked on the resources, and you may have seen this before. It's pretty popular. The 5-step 1-minute preceptor tool, and Curtis, K-E-R-T-I-S, 2007 is the author that writes about this. But there have been quite a number of different authors and people who have talked about this. It's really very difficult to do in 1 minute, all of these things. And so another author calls it the 5-minute preceptor tool. But basically it's the same thing. You first, when you're trying to get someone to reflect and think about a concept and you want them to grow and develop, you, in a scenario, you get a commitment. What is this? You probe for supporting evidence. Why do you know that this is what it is? You teach the general rules. This is what you would do under most circumstances. You reinforce what was done right in the situation by the preceptee, and then you correct mistakes. In this environment where you can learn like this, it is very engaging, very encouraging, and it isn't as terrifying as some situations can be. It's meant as learning, and so we as teachers and coaches want people to succeed and continue to develop. We often think of this idea of teacher as the stage on the stage, someone giving all the information, sort of like I'm doing right now, talking. The coach is the guide on the side. Actually, what we will do with one another in the blog, if you could share your experiences, that is coaching one another and helping us think about, what is happening in one situation or another. The definition of coaching is helping others find the answers within themselves, tapping their own wisdom, passion, perseverance, and strength, helping them gain understanding and meaning within their circumstances, and then taking action to move through a challenge. And again, your blogging about this would really be valuable. I would like for you to meet in the next clip. This is Christine Miller. She is a senior undergraduate nursing student, pre-licensed, and she will be graduating in about 6 weeks. She is now in a precepted management and leadership course, and in this clip, she actually describes how her preceptor served as a coach to her. Now, she doesn't know that this is coaching, but by her description, this is an excellent example of a coach.
What I've really enjoyed about my preceptor for leadership and management is the way she teaches me. For example, with employee evaluations and also with the budgeting, she'll explain how she does it. She'll walk through the steps with me, but then she'll have me do it on my own and go and sit back at her desk, being there if I have any questions, but actually watching her do it and then doing it myself and then explaining to her why I did it that way has really taught me valuable lessons in the objectives she's teaching me.
Another role after coach, the leader influencer. I really like this quote by David Leach. Authentic leaders are not made, nor are they born. They are enabled or disabled by the organizations in which they work. And I can't say, we all can picture this in action, I'm sure. Leadership is an expectation of all registered nurses. And this is actually a statement from ANA in 2010. Nurses lead and influence through application of professional values. And that's AACN 2008 quote. And some of the characteristics that we want to our next generation of nurses to really understand and be able to put to practice. The whole idea of altruism, a concern for the welfare and well-being of others, autonomy, a right to self-determination, human dignity, respect for inherent worth of all individuals and populations, integrity, acting in accordance with the code of ethics, standards of practice, social justice, which is fair treatment, and diversity. And often when we run into difficult situations in a clinical site, in a clinical area, we can often stop to recognize and dissect the value and the conflicts, the value conflicts and the conflicts that are in the middle of a situation that is difficult to resolve. So helping students do that is a real value. When they can understand your thinking through a story or an aside to them. This is what just happened, or what do you think just happened? So that's part of that way that you lead and influence that next generation. As a facilitator for preceptors, facilitating is a learning experience comes from a clear understanding of the level and expectations of the experience. What are the specific clinical objectives and clinical competencies that the preceptor should achieve? What experiences are needed to facilitate and plan a learning experience? So this is, we'll talk about this more in Module 3 and 4, but often what we like to see to facilitate preceptor experience, often the preceptor will do an assessment to begin with and try to understand where is this person coming from, what do they know so far, and what do they have to accomplish by what date. And because this is time limited, often our organizations, if this is a new nurse, there's only so much time before that person has to be ready to take up the banner. And just as an aside, today I talked to a gentleman that is a new nurse. He just graduated in December. He's in a nurse residency program. He came by and just to talk about what a wonderful experience he's having, how they're really pushing him. But they are, by they, I mean the nurse, and he has several people who really look out for him. They try to get him to increase the number of patients he's seeing and the type of patients he's taking care of, but they're always there. They're there to help, and they're there if he gets in trouble and gets behind, can't get the charting done, whatever. He was very complimentary, and I was just thrilled to hear that today. And I need to go over and thank those the people who are serving as his preceptors. He's newly licensed, and he'll be a great asset. And he just needs a little bit of time to get his bearings, and that's what preceptors allow you to do. So, socialization specialist. Henshaw says, in 1977, this is an old quote, socialization is the process of learning new roles and the adaptation to them, the process of becoming a member of a social group. Formal and informal expectations, unwritten rules, the norms and taboos. We know all about what this means in nursing. This is where the individual, and we see this a lot in new students, new to the program, new to nursing, this whole idea of transitioning from an individual in a social role to a professional role. So role model and protector, This role is demonstrated competence, adherence to standards of practice, creating a safe environment for patients, for preceptees, to learn to ask questions, to protect them from lateral or horizontal violence or workplace bullying. This is the greatest, the most at-risk individual in the organization is a student or a new nurse. And this is documented in the literature repeatedly. And there is now a zero tolerance policies that the ANA has established in several other organizations for lateral, horizontal, nurse-to-nurse violence, belittling, behaviors of all kinds. And so it has been inspiring to read the literature that's out now. Modick and Schussler talk about be alert to behaviors, be aware of preceptee vulnerability, model professional behavior, help preceptees name behavior and learn how to speak about it, and create a healthy work environment. Our graduating seniors now talk about healthy work environments. I don't ever remember even that being a term back in the day, so it's good to hear them talking about that. Finally, as evaluator, we want to know what are the criteria-based competencies expected for this individual. What is the preceptor role in evaluation? What approach do you use in providing constructive feedback? And what improvements are expected? So the preceptee, this is either a pre-licensed undergraduate from an Associate of Science or Associate Degree program, a generic BSN bachelor program, an accelerated bachelor program, or a diploma program. Not a lot of diploma nurses around anymore, but could, not in our state, and maybe not in your state, but basically a pre-licensed person. The other person that might be available to precept is a licensed RN to BSN student. So somebody that's moved from associate degree to BSN, already licensed. Or a licensed RN graduate student in a master's or doctoral program. A new RN graduate, or a newly licensed RN. And, it could be a new employee, somebody that's experienced but is brand new to the organization. So you will have the opportunity to, and probably already are defining the preceptees that you are working with. The value of the preceptee. This is an individual that comes to us with wisdom, interest, and the capacity to learn. They're always an adult with valuable lived experience of one type or another, insights, insecurities, and needs. They are the next generation, and we are in desperate need of them to join us. They are our soon-to-be colleagues, and they are our future caregivers. And many of us have had experiences where we've been in an area for a long time and taught in a school, and then we unfortunately have to go to the hospital for something, and we're thrilled to see that there are the nurses, that they are our caregivers. It's humbling and it's gratifying. And I can tell you, it's the most exciting thing I've seen in a long time, is to actually see those nurses and see how professional they are. Description of the preceptee experience, what you want to ask, what is the purpose of this particular experience for this particular individual? And it can vary depending on what the course is, whatever the, so hopefully you have a very clear picture of that. It can vary depending on what level that individual is and what the goals of your organization might be. So this is a question only you can answer. The other thing we want to always be able to ask, we'll talk about this more in Module 4, what are the goals of this experience? What are the goals and the competencies that the preceptee expects to gain with this experience. And so this is rather vast, but you want to hone in and so that you can know that this is what this person is going to accomplish, and once they are proceeding to accomplish that, I can give them encouragement along the way. It's when we don't know what the goals are, we all get lost. So, the faculty, you want to be able to know what the faculty role is, the value of the faculty, the definition. For us, we think about how we utilize preceptors and when. One of the most important things that faculty members must do is they must ensure that safe, accessible, and appropriate supervision based on client health status, care setting, course objectives, and student level of preparation. So they look for that person. They're responsible for finding that individual within a practice setting that can provide that oversight. In selecting the individual preceptors and ensuring appropriate qualifications and scope of responsibility, faculty often ask questions, get to know people. They ensure that the preceptor possesses the competencies related to the area of the clinical teaching. That really, so for the management and leadership course, they have to actually have management and leadership experience and be in that role. Or if there's another kind of precepted course or an experience, you just want to find the very best people that you can and connect them. Faculty are very responsible and they need to be providing a lot of feedback. So the value of faculty, I would say, the number one value is there should be a very important resource to you. So at this point, we're almost finished, but I want to let you know about or have you meet Sharon Andros. She is a faculty member, and she is going to explain her role and what she does, how she goes about doing her work as a faculty member. And you can see this is this is about a 4-minute clip, but she really takes this role very seriously. She's one of the most successful faculty collaborators that we have with our clinical sites, and she has repeatedly, people like to work with her because she provides a lot of important information.
Hi, I'm Sandy Kuntz, and this is Sharon Andros. And Sharon is a faculty member who teaches in a precepted course. And so, Sharon, I just wanted to have you describe your role as a faculty member in this precepted course. What is your role and how do you communicate with faculty?
Okay, first off, I'd like to say that I really enjoy having preceptors and working with the faculty, with the students and the preceptors. I think it's a real good marriage. Also, I think communication is the essential tool to have a good relationship with that preceptor before you place the student with that particular preceptor. What I usually do, because I do 487 Leadership and Management course, I communicate with the student prior to the start of the course to find out what their interest areas are. And then I try to choose the area. I have them give me three and prioritize those. And then I look at which preceptor I think will match that student the best. What's their style? How do they communicate effectively? And whether or not they can mesh. And sometimes if I have a student who's super anxious and super organized, and I'll place them with the manager who is really calm and slower paced, and so that they can modulate that some for the student.
So how often during a semester would you communicate with a preceptor?
I communicate real frequently. I meet with the preceptors first and indicate whether or not they are interested in that semester having a student. So I get that cleared up first. If they say they are interested, then I proceed and I send them the packet, the preceptor packet, and I make sure they have the syllabus, the course outlines, all the evaluation forms, everything that they have. And then I meet with my student, and I have the student put together their resume and a cover letter, so they have that in place when they meet their preceptor for the first time.
Good. Great.
After that, I go with the student to make their first contact. And I think that's really important, as I think it sets the tone for the whole semester. So then the student can ask questions, the preceptor can ask questions, we're all on the same page. So I meet with the student and the preceptor together. Then I communicate with that preceptor frequently throughout the semester. I do that via email, and I also make visits. I personally go over and talk with the preceptor to find out how everything is going. Is there anything that they need from me? Do they have any concerns in relationship to the student? Is there anything that they need from me that would be helpful in their preceptorship?
Right.
And then I'll do that with the student also.
Good.
To find out. If the student's having a difficult area with the preceptor, I meet individually with the student, find out what that particular situation is, and then I will meet with the preceptor and see what their perspective is of the situation. And if necessary, then I'll have the three of us meet together and look at what we might be able to do to resolve that conflict.
Thank you. Thank you very much.
Mm-hmm.
So in summary, we've discussed national standards and initiatives that impact and enhance the role of the preceptor. We've located the competencies essential for preceptor practice, the AACN Essential Series, BSN, MSN, and DACO, the American Academy for Preceptor Advancement website. We've described the roles, responsibilities, and relationships necessary for a dynamic preceptor, preceptee, and faculty partnership, including all of the roles that we've gone into in detail. We've started the process of identifying coaching strategies that inspire growth and development of the preceptee. So we would like to invite you to the blog, and we really encourage you. Here are some questions that you might consider, and I won't read these to you. You can read them yourself. And on the website, you can communicate a story or a situation. You can think about how you use the documents, the Code of Nursing or the Standards of Practice, or just how you have been effective in one way or another in the preceptor-preceptee faculty triad. So we really hope you will blog for Module 1. And with that, we will ask you to go to the Module 1 evaluation, and once you have submitted your evaluation, then you will be sent your free contact hours that will be provided along with this Module 1. And that's the end of Module 1, and we look forward to seeing you and talking to you again in Module 2.